Hi, I'm Jessie, Doctor of Physical Therapy at Resonant Frequency Medicine, and this is my favorite exercise to mobilize the thoracic spine. You have a lot of options for this. You could use a rolled up blanket, you can use a Coregeous ball, a half foam roller, or a full foam roller, 6 inches. Really, it depends upon how much pressure you like on the spine and how much mobility you're going for. My personal favorite is the Coregeous ball because it allows for lots of modifications in this posture. So I'll be demonstrating with the ball. You can also get an inexpensive ball at the dollar store and let out some of the air. You don't want it fully inflated. You could also use a Pilates ball. So the area of our target is between the shoulder blades. You want to position the ball so that you can segmentally mobilize each of the bones of the spine between the shoulder blades. You don't want to go to the neck in this one, and you actually want to avoid the lumbar spine, the arch of the low back. We are really focusing on the thoracic spine between the neck and the lumbar. At the end, I will demonstrate a little additional mobilization where you're positioning the ball at the level of the sacrum, the very low back that is beneath the lumbar spine, and that's also a nice way to give yourself some core work and additional benefit. You might as well do that while you're on your back. So the setup here is important. We are really focusing on mobilizing the upper back and not the neck. So you're going to interlace your hands so that the web of your fingers are touching, and you're going to place, thumbs are facing down, and you're going to place this setup behind the neck. It looks like this. Okay, thumbs can face down or they can just tuck in here. It's important to have the hands right at the occiput to the nape of the neck, and then you're going to squeeze the elbows in toward each other so that you're actually kind of locking in this system of the upper neck, so that the neck and the head move as one unit, and you're not extending the neck. Instead, you're extending from the thoracic spine. So that's an important factor when you get into the position on the table. So you'll start sitting on the floor with knees bent, facing away from the ball. And you might hold on to it if you have the flexibility to do that, or just wait till it lands and then scoot about a foot ahead of it so that when you land back onto the ball, it's right between your shoulder blades. Now, your shoulder blades are long and there are multiple spinal segments between your shoulder blades. So you might roll so that you're feeling the ball right between the lowest point of your shoulder blades in the center of your back on your spine. And then interlace the fingers so that the web of the fingers is touching, and position the hands at the base of the skull so that as much of your fingers are wrapped around the back of your neck as possible. From here, you're going to hug the elbows together so that the forearms are touching the cheeks, and this helps you to create this segment that moves all together between the head and the neck and the upper arms. Inhale here. Exhale, sink your front lower ribs toward the table or the floor, toward your back. Inhale to extend over the ball. Exhale to come up. Inhale to extend. And go nice and slow here. Slow your breath. And very simply here, we're mobilizing into flexion and extension of the spine. You might want to linger in the extension. Maybe the back of the head touches the table, maybe it doesn't. Breathing, explore a side bend here. Moving the whole unit of your head, neck, and shoulders toward the right hip. So you're kind of C curving the spine, and then toward the left hip. And then another variation here is you can go side to side with the elbows, which rotates this segment of the spine. Use your breath. So really create as much expansion on the inhale And as you exhale, as much emptying out, relaxation, melting over the segment that you're on. When you're ready to transition to the next vertebral segment, you'll exhale to lift, and then just roll your hips down about an inch so that the ball rolls up about an inch to the next vertebral segment. Inhale to lower. Flexion and extension for a few rounds here. And then maybe a little side bend. And you can be creative. Side bend your way into extension. And then into flexion. Inhale back into extension. And rotate side to side with the elbows. Can be a tiny little rotation, it can be a big rotation, whatever feels like it is the most nourishing for your spine. That's what you're after here. When you're ready to transition, exhale to come up. Roll your hips 1 inch farther down so that the ball rolls up a little bit higher on your spine. Inhale to lower. Exhale to lift. Repeating for as many segments of the spine as you can articulate. With the squishy ball, you can feel a little bit less specificity than if you were to use a foam roller. So just explore different ways of doing this and see what feels best for your body. Now, before we come all the way off the floor, I like to do one more thing with this ball. So you'll roll to the side, take the ball away, place it between the feet or near the feet, and then you'll come into a bridge, lifting the hips up. Roll the ball under your lowest hips so that it's almost right at the gluteal cleft, which is a fancy word for butt crack. So keep the ball pretty low. It's almost too high for me. We really want to avoid arching the spine over the ball. That's not what we're going for. We're not trying to do anything with the lumbar spine here other than keep stability there. So you roll so that the ball is almost at the tailbone. From here, take a nice full breath in. As you exhale, lower the lower front ribs toward the lower back ribs. And keep that. And then you can play with marching 1 foot at a time off the table. And notice, can you relax your neck and your jaw? And can you keep this movement happening in slow motion from the lower activation of your transversus abdominis, the lower belly muscles. And then maybe extending the legs up for a little modified Viparita Karani, which is a yoga pose, legs up the wall pose. This is a really wonderful way if you have 5 minutes in the middle of your day to give yourself rest and relaxation, but also it'll give you an energy boost once you bring your head above the level of your heart again. And you can also bring the knees into the chest and just really give your low back some elongation here. This is contraindicated if you have a disc herniation, so don't do this if you have a disc bulge or herniation in your low back. But if you are looking for some elongation of the spine in the low back, same idea. So by bending and straightening the hips, bending and straightening the elbows with the hands on the knees, you're doing that same flexion extension as we did between the shoulder blades for the thoracic spine, but this is just really targeting the SI joint, the lumbosacral joints. And then you can also bring your arms to a T and go side to side. And the slower you do this, the more slow motion you go, the more stability you will recruit from your core muscles. And you can also do a little side to side with the hips, lifting one hip toward your armpit at a time. to come out. Feet come back to the floor or the table, lift up into a bridge, and then slowly remove the gorgeous ball and lower down. Roll to one side and sit up when you're ready to. Thanks for practicing with me. I hope this is helpful to keep your spine really mobile and happy and free.